the largest cardiac diameter divided by the distance between the two costodiaphragmatic angle, which is also called the thoracic diameter. The thoracic diameter or the lateral thoracic diameter, because the thoracic diameter we have two. We have anteroposterior thoracic diameter, we have the lateral thoracic diameter. Is it clear? And when you have an anteroposterior diameter and a lateral thoracic diameter which are equal, it is called a case of a barrel chest. Is it clear? And a barrel chest occur in patient that has obstructive pulmonary diseases like asthma, like chronic obstructive pulmonary diseases. And with also lateralization of the ribs are going to occur in such patients. Now this diameter that you measure here is a lateral thoracic diameter. Is it clear? Normally the lateral thoracic diameter has to be 2 centimeters, 1 to 2 centimeters above the frontal, the anteroposterior thoracic diameter. Else is going to be called a barrel chest occurring in obstructive pulmonary disease cases. So when you measure the cardiothoracic index, which is the cardiac diameter divided by lateral thoracic diameter, you have the cardiothoracic index. If the cardiothoracic index is less than 0.5, it is good. Is it clear? So cardiothoracic index has to be less than 0.5 in adults. In children, it has to be less than 0.55 in children, because the heart of children is slightly higher than that of adults. And then in neonates, it has to be less than 0.6. Is it clear? It has to be less than 0.6. So in children that are so neonates to 3 years, neonates to 2 to 3 years, it has to be less than 0.6. But from 2 to 3 years to 12 years, it has to be less than 0.55. And then after 12 years, it has to be less than 0.5. Those are the how. If it is more than that, you have to say that that is now cardiomegaly. Is it clear? Now we need to find out etiologies of cardiomegaly. So when you have cardiomegaly, what can you think of? Cardiomegaly, what can you think of? Now you need to know that cardiomegaly is divided into two. Is it clear? It is either it is the left heart that is hypertrophied, or it is the right heart that is hypertrophied. Those are the different things that you have to know. It's either the left heart that is hypertrophied or the right heart that is hypertrophied. But now, how can you know that it's the left heart or the right heart? When it is the left heart that is hypertrophied, the apex is seen below the diaphragm. Is it clear? The apex is seen below the diaphragm. That's the first point. It means that what? It means that you have the X-ray as such. You see this, the apex going below the diaphragm like that. Is it clear? When the apex goes below the diaphragm, you see the apex here below the diaphragm, you know that this is a left heart enlargement. And the right heart enlargement, the apex does not go below the diaphragm. Another again is that the growth of the left heart is going to be obliquely down, while the growth of the right heart is just going to be lateral. Is it clear? And in children, it goes laterally and up, particularly when it produces a boot-shaped heart. Is it clear? So what do I mean by that? If you have measured cardiothoracic, the normal shape of the heart, this is normally how the heart should resemble. Let's say this, the normal shape that the heart should resemble. Now, if the heart goes in this direction, you see that it's going to go and take this morphology that was up here, and you see the apex is going to be below the diaphragm, the left diaphragm. Are you understanding? If it goes in this direction, the apex is going to be below the left diaphragm. Now, in the case of the right heart enlargement, it is going to grow instead in this direction. So basically, in the left heart enlargement, it grows in this direction. In the right heart enlargement, it grows in this direction. It means that you're going to have instead a heart. So you're going to have instead a heart which is as such. Is it clear? So if you have an enlargement of the heart, the apex is above the diaphragm. If you have the apex above the diaphragm, but you have an enlargement of the heart, you think of a left heart enlargement more. Is it clear? And you have also the right heart silhouette is increased. Is it clear? This right heart silhouette is also going to increase, to bulge out. It also tells you that it's a right heart enlargement. So those are how you can already think of the different enlargement on the X-ray. So you have right heart enlargement, you have left heart enlargement that you can see, that you can visualize on X-ray. Another element that you can see on X-ray, you have the superior vena cava. The superior vena cava is what enters directly up here is a superior vena cava, as I've explained. Now, the pulmonary trunk, to visualize the aortic arc, you need to know that we have the cardiac silhouette has 3 arcs on the left side. You have 1 arc which shows the aortic arc, you have 2 arcs which shows the pulmonary trunk, and you have the third arc which shows the left ventricle. Those are the 3 arcs. When you have a problem with this arc here, let's say that there's a disappearance, there's a strengthening of this arc, is it clear? If this arc become more straightened, is it clear, more longer, is it clear, is it clear? Particularly in this case, let's say that you have the diagram like this. This is superior vena cava, this is the right heart side of the heart, this is the left side. Now it becomes like this, is it clear, before you see the second and then you see the third. If it's like this, you think of a systemic hypertension, an aortic hypertension. When there is a systemic hypertension, it's going to get more straighter, this arc here. Is it clear? So showing you that there is hypertension inside the aortic arc, and that hypertension inside the aortic arc can also come as a result of an aortic stenosis. Is it clear? So those are the different elements that you have to understand. Still on your X-ray, we have already explained that when there is a disappearance of a second cardiac arc, it shows that there is a pulmonary hypertension because it becomes more straightened. Is it clear? Now, this you can have the ventricular hypertrophy. You said that it is going to be in direction. So those are the different elements, and you have particular cause of left ventricular hypertrophy is when you have a systemic hypertension, a long-lasting hypertension. So if you have a patient that has a chronic hypertension occurring for a long period of time, more than 6 months, you already know that he's going to have a left ventricular hypertrophy that is going to be shown here. So those are the different things that you must put in mind when you are studying this patient, cardiomegaly and all that. Now the next element that you have to visualize is the diaphragm and the pleural space with effusion.